Many people believe that if calcium starts depositing in the blood vessels, it is simply a matter of aging, that arteries wear out, become rigid, and that nothing can be done about it. But in medicine, there is a phenomenon known as the calcium paradox. It is a condition where the body has enough calcium, sometimes even too much. Yet at the same time, bones become fragile, while blood vessels turn hard like concrete. This very process underlies a huge number of heart attacks and strokes. And what is most surprising is that it can occur even in people who take vitamin D and calcium supplements. This is Dr. Helena speaking. When I worked with patients with cardiovascular diseases, one case clearly showed me how common this problem really is. Several years ago, a patient came to see me, a man around 58 years old. He led a fairly healthy lifestyle. He did not smoke, he took vitamin D, and he paid attention to his diet. But during examination, he was found to have significant calcification of the coronary arteries. In fact, his vessels had begun to turn into what cardiologists sometimes call porcelain arteries. And this is where the most interesting part of the biochemistry begins, something that is rarely discussed. The thing is, calcium itself does not know where it should go. It can strengthen bones, or it can deposit in the walls of blood vessels, in heart valves, in the kidneys, in other words, in places where we absolutely do not want it. That is why the body has an entire system of proteins that regulate calcium distribution. One of the most important among them is MGP, or matrix GLA protein. Its main function is to protect blood vessels from calcification. You can think of it as a kind of vascular defense system against calcium buildup. But there is one important nuance. At the moment of its synthesis, this protein exists in an inactive form. It is present, but remains inactive. And for it to start working, a specific biochemical key is required. That key is vitamin K2. When there is enough vitamin K2 in the body, a process called carboxylation takes place. This is the moment when MGP becomes activated. Once activated, it begins to perform its main function. It helps bind calcium and prevents it from depositing in the vessel walls. It helps maintain vascular flexibility. And that is why some researchers refer to vitamin K2 as the vitamin of elastic arteries. But if vitamin K2 is lacking, the situation changes. MGP remains in a dormant state. It is present in the body but unable to stop vascular calcification. As a result, calcium gradually begins to accumulate where it does not belong. This process can continue for decades, almost unnoticed. That is why vascular calcification is often discovered only when the changes have already become significant. There is even a specific laboratory marker that allows us to assess this process. It is called DP-UCMGP, dephosphorylated uncarboxylated MGP. This is the form of MGP that has not been activated by vitamin K2. And the higher the level of this marker, the higher the risk of vascular calcification and cardiovascular events. Unfortunately, this test is still rarely used in routine clinical practice. However, in research settings, it is considered one of the key markers of vitamin K2 deficiency. If we talk about objectively assessing vascular calcification, one of the most informative methods is computed tomography with calculation of the calcium score, the so-called coronary artery calcium, CAC score. This test allows us to literally see the amount of calcium in the walls of the coronary arteries and express it numerically. It is excellent for detecting already established calcification, but there are also methods that allow us to identify changes earlier or from a different perspective. First, there is ultrasound of the vessels, Doppler ultrasound. It does not visualize calcium as precisely as CT, but it allows assessment of arterial wall thickness, intima media, and the presence of atherosclerotic plaques. This is a good way to understand whether vascular changes have begun even before pronounced calcification. Second, CT angiography. Unlike a standard calcium score, it allows visualization not only of calcium, but also of plaque structure, the degree of vessel narrowing, and blood flow. This is a more detailed test, but also more complex. It requires contrast and involves higher radiation exposure. There is also MRI of the vessels, MR angiography, a radiation-free method that helps assess blood flow and the condition of the vascular wall, especially in the brain and neck. However, it is less effective at detecting calcium compared to CT. Now, a logical question arises. If vitamin K2 is so important, why is it discussed so little? The reason is quite simple. For many years, the primary focus in cardiovascular prevention has been on cholesterol, pressure, blood sugar, and that is absolutely justified. But today we understand that vascular calcification is a separate and very important mechanism of cardiovascular aging, and vitamin K2 plays a significant role in this process. Interestingly, many people already take vitamin K2, but most often it is in the range of 100–200 micrograms per day. This is indeed a good preventive dose. However, studies show that in the presence of atherosclerosis, diabetes, chronic kidney disease, significant vascular calcification, the need for vitamin K2 may be considerably higher. In some clinical studies, doses of 360 micrograms of MK7 per day or more have been used, and they were administered over many months. Such long durations are necessary to influence biochemical processes within the vascular wall. But calcification is not only about calcium. There is another important factor: inflammation. Many people are surprised to learn that calcification of an atherosclerotic plaque is actually a protective response of the body. When a vessel is damaged and inflammation occurs, the body attempts to stabilize the plaque, and one way it does this is by depositing calcium, acting like a kind of cement. This helps reduce the risk of plaque rupture, but at the same time, it makes the vessels less elastic. And over time, this can impair blood flow. Interestingly, vitamin K2 affects not only calcium. Some studies suggest that it may influence inflammatory signaling pathways, including nuclear factor kappa B. This is one of the central regulators of inflammation in the body. Thus, vitamin K2 potentially works in two directions. It helps regulate calcium distribution. It influences inflammatory processes. This combination is what makes it particularly interesting to researchers studying vascular aging. But there are several additional important details that are often overlooked. The first is fats. Vitamin K2 is a fat-soluble vitamin. This means its absorption directly depends on the presence of dietary fats. If taken on an empty stomach or with fat-free food, its bioavailability may decrease significantly. Therefore, it is best taken with foods containing healthy fats: olive oil, eggs, avocado, fatty fish. The second important point is synergy with vitamin D3. These two vitamins function as a biochemical team. Vitamin D stimulates the synthesis of proteins involved in calcium metabolism. But for these proteins to function properly, vitamin K2 is required. Therefore, taking high doses of vitamin D without sufficient K2 may lead to calcium imbalance. And the third factor is magnesium. Magnesium is involved in the activation of vitamin D and influences many enzymatic processes. Without adequate magnesium levels, this entire complex system of calcium regulation becomes less efficient. That is why vascular health is not about a single nutrient. It is a complex biochemical ecosystem involving dozens of factors. But understanding these mechanisms gives us something very important: control. We cannot completely stop aging, but we can understand the processes occurring in our body. And sometimes small changes in lifestyle and nutrition can significantly impact long-term health. Our arteries are naturally designed to be flexible and elastic. And the goal of modern preventive medicine is to do everything possible to keep them that way for as long as possible. Because vascular health is not only about the heart, it is about the brain, about memory, about energy, and ultimately, about quality and longevity of life. If you are interested, in the next video we will discuss another lesser-known mechanism of vascular aging: glycation, sometimes referred to as the caramelization of our tissues. And believe me, this process may be just as important as cholesterol. Take care of your blood vessels, and treat your body as a system that deserves understanding and care.